Good morning, ladies and gentlemen, and welcome to Living with S. I'm your host, Sharon Mundia, and today we are at Park Inn by Radisson. Beautiful view from 11th floor. In fact, before the camera's rolling, we were just noting like all the greenery that we can see across. Thank heavens for the rains. Today's show is about our health and wellness and the ways in which we can do better for our children and for ourselves. And I've got two people who are going to share a little bit more about this and their personal experiences. I've got Joe Otin, who's the district governor of Rotary District 9212, which I now know 9212 means Kenya, Uganda, South Sudan, and Eritrea.
Correct.
Welcome. I love your bow tie. I love it. And then we've got Rehab Wamboi, who is a polio champion survivor. Welcome, Rehab.
Thank you.
So, before we even start getting into the conversation about polio, I'm curious to know how you got involved, Joe, because your background really is in something completely different, isn't it?
Yes, yeah.
Yeah, so how did this become of interest to you?
Well, Sharon, thank you so much for having us in this show. I joined Rotary in about 2001, and when I got into Rotary, I found that they had a commitment to the children of the world to rid the world of polio. And polio, this would be the second disease in our human history to be eradicated. And this
the first one being?
Smallpox. And smallpox was eradicated in the 70s. So this was going to be the second one. And because science showed us that it was possible to eradicate polio, so that no children would have to have the effects of this debilitating disease or even die. And in 1985, when Rotary made a commitment through a program called Polio Plus to eradicate polio from this world, there was 350,000 children across the world every year that were being affected by polio, being infected, which meant several of them died and quite a number of them were paralyzed because the polio virus affects the nervous system. So I joined Rotary, and I found that they had this. They were determined to end polio, and over the years we've increased the amount of funding that we've been doing as Rotarians to the PolioEradication initiative, and I think so far we've already raised and given to the PolioEradication initiative $1.6 billion.
$1 million.
Billion.
With a B?
With a B.
Oh, wow.
Yes, yeah.
Wow, incredible. So what are the numbers now? If it was 350,000 children.
So, as of today, this year, there's been only 81 new cases of polio. And those are mainly actually only in Pakistan and Afghanistan.
81?
81.
In the whole world?
Correct. And that is based on the fact that not only Rotary has been funding this, but the Global Polio Eradication Initiative has WHO, CDC, UNICEF, the Bill and Melinda Gates Foundation, and the governments of the world. And I think to date, the total amount of contribution has probably been to around $8 billion in total. So this shows that we're actually able to eradicate polio. We're 99.9% on the way there.
Yeah, that is a drastic drop. 350,000 to 81.
Correct.
That's incredible. For people who aren't aware, what is polio? Maybe Rehab, you could take us through that. What is polio?
Okay, polio is a virus. Yeah, it's a virus that is infected through waterborne. It's a waterborne disease, and also through feces. We can acquire it through feces. So it is normally taken through food, or through dirty waters, or through feces.
Right.
Yeah. So it's a virus that gets into the body and affects the system by paralyzing part of your body. Yeah, like in my case, I was paralyzed from the hip downwards.
Okay.
In some cases, there are chances of improving and changing your condition, and in other cases, you die.
Wow.
Because it is not reversible. When you acquire polio, it's either you die or you have to deal with it as a disability
For the rest of your
for
life.
the rest of your life. Yeah, yes.
When were you diagnosed?
I was diagnosed with polio at an age of 1.5 years. That is back 1971. And my mother did not understand what it was. By then there was no, I don't know whether there was polio vaccine, but I didn't have the immunization. So my mother came back. She was a casual laborer. She came back from work and found that I was suffering from flu and fever. So she decided to take me to the nearest hospital. By then, Getundu Hospital, that is my hometown. And that is when I was pronounced to be affected or infected by polio virus. So I was referred to KNH, Kenyatta National Hospital. Yeah.
So at 1.5, I mean, I'm sure you were too young to even understand or remember, but I'm sure you've been told, or you know how it started to affect you. So I'm curious to know, how did it start to take effect on your life and your body?
Yeah, it started by fever.
Okay.
Yeah. That is what my mother tells me. Okay, I was able to walk at an age of 7 months. So by then, my mother used to leave me at a nearby nursery school when she goes to work. So she came back home in the evening and found that I was having fever. She decided to take me to the hospital. So from that moment, when the doctors attended, the doctor attended to me, I was injected. After the injection,
Injected with what?
I don't know,
Okay.
because that is what my mother tells me. Okay. After the injection, I was not able to stand or sit or do anything. But later they referred me to Kenyatta National Hospital, and that is when my mother was told that I had been infected by polio, because I got paralyzed completely. I could not stand, I could not sit. Yeah,
and it's not clear what that injection was meant to do, or what it was for.
Yeah, probably it was meant for the fever, not for polio, because by then there was no polio immunization. I don't know whether it was there, but my mother hardly knew about it.
Right.
Because my mother tells me it was measles, according to what she's aged, so she thought it was measles. But after the injection, I could not stand. But they realized I had already been infected with the virus.
Wow.
Yeah.
So from your research, was this something that happened quite a lot back in the 70s, maybe even through to the 80s?
It did, yes, yeah. And I mean, if you look at the in the 60s, I think the United States must have had about I think it was 20,000 cases of polio. I think 6,000 of them resulted in death. And but it was in 1955 that Dr. Jonas Salk had developed a polio vaccine, and at that time the government of the United States said that it was safe to use. And the 2 drops were then developed, I think, 5 years later in 1960. And so generally, the way the polio vaccine is circulated now is that you give 2 drops to children under 5 years old, and it became very practical in terms of being able to then start to reduce the number of cases of polio. And unfortunately, in Rahab's case, there had not been any polio vaccines being given to the children, obviously in her neighborhood, and that was the reason why she got polio. She contracted polio, and so we're trying to. The government has really increased the surveillance and the coverage of immunization across the country. But recently, I think we found some polio-derived viruses in the sewers. And this was just about a year ago. 2018, yes, in 2018. And this was obviously, it becomes a real issue. And a vaccine-derived polio only becomes possible when the immunization coverage is low. Right.
Sorry, say that again. A vaccine?
Vaccine-derived polio.
Okay.
Which means that it's like the vaccine itself, the dead viruses within the vaccine become active.
Okay.
Right. So this
wait. So let me see if I understand you. The vaccine can give you polio? Is it? What do you mean by the dead viruses are not active?
So generally, the way vaccines happen is that you get you put in dead viruses within the solution, so that the body can then develop the red cells to fight that. And I'm not much of a scientist, but the key thing here is that vaccine-derived polio can happen only when immunization is very low, and immunization has been low over a period of time. So thank God that has not led to any paralysis or death, right? But having found that, the government has increased its coverage and has run a number of national immunization days since that time. And recently, $40 million came from WHO to support the government's efforts. And part of that money was part of the money that that Rotary has raised for the polio, for polio eradication, because we're working together in the global polio eradication initiative.
Wow. So, Rhea, back to you. I'm curious to know how your childhood was. After they injected you and you suddenly couldn't sit and stand, when did things change for you? What happened next?
I can say things changed immediately. When I was, my mother got the report that I'll never be the same, I'll never be able to walk again. So she went back home and shared this with my dad. He was not ready for the news. He felt it's not supposed to be the case. So it was not easy because my mother had to attend therapies in Nairobi, that is KNH by then. And having been in Getundu, based in Getundu, and as a Kasho Rebara, she could not afford to come to Nairobi daily. My father was not supportive, so my mom had to relocate to Nairobi permanently, where she had to live on the streets of Nairobi to be able to take me for clinics or therapies. I was supposed to attend therapies twice per week, Tuesdays and Thursdays. So she had to literally live in the streets. Yeah, until later, when there were Wazungus, Europeans who are doing the therapies for us, they realized that we've not been changing clothes. My mother was dirty, and there was another boy, my younger brother. And she was given a room in the facility where she could stay with us, and we used to feed with the milk and bread that they used to give the kids who came for therapy. So after some time I went for assessments. They referred me to Dhika. There was Joytown Special School by then. So I was referred there for assessment, and I was able to be absorbed in the special school because I could not attend a normal school because I couldn't walk. I had to be carried. There were no wheelchairs then, so everything was just hard.
Completely different.
It was completely different.
Right.
So I was to be carried by my mother to school, which was not possible. So I was taken to Joytown, and after undergoing intensive therapy, I joined Joytown Primary in 1978, and I went through therapy through my immunization.
When you say therapy, what exactly? Is
It's
it
called
a chiropractor? Physiotherapy.
Yeah,
Okay.
physiotherapy. They do a lot of exercises, bone exercise,
Okay.
and also several operations. I had to go through several operations, bone operations.
Was this painful, both the therapies and the operations?
It was because mostly I was in a cast, to be able to walk. I was in a cast. So when I went through operation, I was put in a cast, and I could use a wheelchair. So I moved on a wheelchair for the first 5 years. I moved on a wheelchair. Then from there I graduated. I used calipers. Calipers are the ones we use for our legs, and crutches, both crutches. So I went up to class 8 in both calipers and crutches. Then when I joined secondary, I underwent another operation. I was able at least to remove one of my calipers. My right leg was able to recover a bit. And
what is that? Is that something that's put inside your leg?
No, it is calipers.
External support.
Okay.
Yes,
The metal external support. You might have seen a number of people with that, and mostly people who had suffered from polio. And what happens is that it affects the nervous system and then the growth of the limbs. And so you'll see quite a number of people in crutches and calipers, the metal support on their legs, just to help them to be able to move around.
Wow.
So that's the support helps your nerves to regain
regenerate,
slowly, with a lot of therapy and also nutrition. So we had a lot of that in school. We had a
Wow.
lot of that in
Yeah.
school. Fortunately, by then it was a sponsored school
Yeah.
by the Salvation Army Canada.
Yeah.
So they used to give a lot of assistance. And also we had Rotary.
Wow, to
Yeah, we
support
had
even back
Rotary.
then.
Yeah, back
Beautiful.
then, yeah.
You mentioned that nutrition was one of the things that helped sort of regain or get you back to some semblance of normalcy. Can you explain, like, were there specific foods you had to eat or not eat?
There were no foods that we were not supposed to eat, but we took a lot of calcium.
Okay.
We were encouraged to take a lot of milk,
Yeah.
eggs, yeah,
Right.
a lot of calcium, food
Yeah.
with calcium,
Yeah.
yeah, because when you're paralyzed, even your bones become weak. So you are not able to stand on your own, you are not able to support yourself. That is why we used to get calipers, yeah, to support us, to stand.
yeah.
So when they give us a lot of calcium, it was also able to help you to be able to support yourself.
Yeah.
The bones were made stronger. Yes.
So when you went to the special needs school, was it in primary school or high
Yes,
school?
primary school, yeah.
Did you find other people who had also been diagnosed with polio?
Yes.
And what was that like?
We were many
Yeah.
at that time, even in my village. During that time, I realized later because we were 3 of us at the same time who got infected. But the others were, one lady, a lady and another young man and me now, we were 3. But only me and the other lady were taken care of. So we happened to go to Joytown together because my mother knew about Joytown before the grandmother, because the other lady, the mother neglected her. And she was left with the grandmother. So my mother told the grandmother there's a chance in Joytown. So we went together. So during my time, we were 3 in my village. Yeah, at a proximity of 200 meters. So you can imagine from other areas. I think it was an outbreak during that season because during my period, we used to share the same story before we knew it was polio, because we used to say it is the daktari who did this to us. Alidunga vibaya, we had all types of accusation because we thought it is the same doctor. From Gatundu, we were 4 of us in Joytown. So we used to say it is the same doctor who did this to us, but we realized later it was polio. There was an outbreak,
Yeah. And were the people in school in Joytown, you said Joytown,
special school, yeah.
Were the people in Joytown who also had polio, were they all at the same stages? I'm curious to know if it affects every...
No, some were badly off. Like my colleague, the lady that was from my area, because nobody took care of her when she was young like my mother did. She was not taken for physiotherapy. She was not taken. So her case, even to date, she's terrible. Because today she's using calipers and crutches. So she was not able to go progressively like I did. And I can say there is a case of one of us who died. Yeah, so I can say I'm a lucky one because I came out strong. And I am a survivor and a success story to many,
Great.
Yes.
Is there a cure for this?
There's no cure.
Yeah.
Once you're infected with the polio virus, there's some people who are completely, who die. There's some people who will have the disability. And then there's some who will end up being carriers.
Carriers?
Carriers, yes.
And by carrier?
Being a carrier means that you've been affected by it, but it has not, the symptoms have not, come out in your body. So which means that through your feces and the virus can spread.
So, but you will never, you'll not be physically affected by it.
Physically affected by it.
But you might spread it to others.
You will spread it.
Wow. And this seems to boil down to a sanitation issue.
Indeed it
for
does.
The most part.
Indeed it does, because it's waterborne and it's mostly found in the sewers. And so Nairobi is one of the countries or one of the cities in the world that has a lab. And we have a lab that is continuously monitoring to see if we have any polio, circulating in the sewers and in the water. And like I said, they found this 1 year ago. They found some vaccine-derived polio viruses circulating.
Okay, so does that mean that there's a carrier, or that there are children?
It means that there's a carrier.
There's a carrier. And
Yes.
how do you identify?
So I guess that's the reason why you have to get the immunization, so there's no cure for it, but the immunization stops children from getting it.
So let's talk about immunization.
Yes.
When is it supposed to be?
So usually
had?
at birth, but what the immunization is targeting children under 5 who are most susceptible to this disease. And if you get the children under 5, and we do this and we have universal coverage, then it means that we will actually bring this disease to an end. And if we don't bring it to an end now, and we stop funding it, it'll only take about 10 years before we go back to 200,000 new cases of polio every year. And so we believe that this 99.9%, we've eradicated polio 99.9%, and we need to do that 0.1% to get polio off this world, and basically nobody will have to suffer the way Rahab has.
Right, yeah. Have there been recent cases of polio in Kenya?
So no,
Okay.
there haven't been any recent cases of polio, and we are off the endemic list. And the last country that got off the endemic list was Nigeria. So it actually isn't off the endemic list yet, but it was certified polio-free, or it had gone 3 years without polio by 21st of August this year. And it'll be another 5 months or so before it is certified polio-free and taken off the endemic list. And then that leaves us with only 2 countries on the endemic list, which is Pakistan and Afghanistan. And in most cases, it's because of the conflict that the polio fighters and the polio immunizers can't get to the children to immunize them.
Yeah.
And that's why the disease has continued there.
Right. Oh, right. Because
Yeah.
it's because of the war.
Yes,
Oh,
because of
so
the
it makes
wars and
it
the
so
conflict.
difficult. So, how many times should one have have the vaccine? And is it only administered to children, or can you as an adult, or should you as an adult
Yes,
even
yeah.
just?
Well, we target the children under 5 because that's what has been recommended, and that if we have the vaccines for children under 5, which is usually the ages when they get vaccinations anyway, then we should be able to then we will be able to eradicate this disease, and so. We're still under threat. I think as Kenya, Ethiopia, Eritrea, and South Sudan, we're still under threat because we haven't gotten universal coverage of the immunization for many diseases as well, but not just polio. And so this helps to be able to do, increase the coverage of immunization, and give us a chance to eradicate this disease.
Did you find that you got support from your community, from the government, Rahab, as you were trying to fight this disease? Did you feel like you wish there was more support, or did you find that there was when you looked around, that people were actually trying to fight this and help you through this?
My story, I think I faced a lot of stigma from the community, starting from my own dad, yeah? So you can imagine. Mine was a polygamous family, so my mother was the youngest of the others. There were other 2 wives. So in the entire family, they could not accept that there is a child who has come in and who is disabled. So according to them, we had a lot of myths and misconceptions by then, yeah? So it was either a case of being bewitched, or it was either a case of my mother's, it was from my mother's area or my mother's home. So I faced a lot of discrimination. There was a lot of stigma. Not until I got to class 8, where I performed very well, and I got a scholarship to go to the US. So the community came together and realized that I was worth, being loved and being cared for. So they gang up and decided that they are going to celebrate this. So they did a party for me, a farewell party, and were able to raise at least 10,000 for my pocket money. So from there, the conception changed. So they started accepting me as part of the community, as part of the society, and being useful. Even my own dad accepted me from there, started accepting me that this is a useful child. And there was a reason why I was there. But that did not end my challenges, because when we went to the US, at least I got a scholarship. I had to join Alliance Girls That is why I was admitted, but I was not able to join because the money that I was given in the US was taken away from me by our head teacher and the mayor, the then mayor in Thika, yes. So I found myself in Joytown again, yeah, struggling for my secondary level education. So I still went through a lot of challenges, but I thank God because I've come this far.
Yeah.
Yeah.
Were there moments that you were angry? You were frustrated.
Yes,
You wanted
and I
to
was
like
very bitter.
And
I
how?
was very bitter. I was really bitter. There was a time my mother tells me I could not even share food on the same plate with my siblings because I used to feel even my siblings hate me. Yeah, so I could not share. There was a time I refused to go home completely. I could remain in school during the holidays. So I was taken by one of the house mothers, the subordinate staffs. I refused to go home because I didn't like the environment at home. Yeah, there was that time. Even there was a time I could not have supper in home. When I go home, when we closed the school, it was a boarding school, yeah? So when I go home, I could not have my supper because my dad could not allow us eat our supper peacefully. So I preferred being in school rather than going to that hostility. So it was that bad, but I thank God because I am here today. I am strong. Yeah. The challenges made me stronger. Yes, and also it is the drive behind what I do today because mine is mainly working for the community as a volunteer on issues of disabilities.
You're truly a champion.
Yes.
Truly a champion. Joe, is this common, that this kind of stigma and people diagnosed with polio being sort of ostracized from communities? Is this common in your research?
It is common.
Yeah.
I mean, and it's not. I think it's worse here. And if you read stories of people who contracted the disease in the U.S. in the 60s, you'll find it was exactly the same thing. And you know, this lady called Mrs. Beatty, she got polio when she was a child. She was put into a hospital, into one of these things they used to call the iron lung. And at that time, the doctors didn't really know much about polio, and so they so basically she was isolated, completely isolated. And even when her parents came to see her, she was behind a net, and they couldn't come close to her, and they used to throw the toys over to her, hoping that they would land on her bed. And her family, when people would see her family walking down the street, they'd turn away because they'd realized at that time the government would put a sign in front of the house to say that somebody in this house had been infected by polio.
Wow.
And so, and that's how it was in the U.S. And now, you know, you see the same kind of thing happening here. It's extremely painful. Extremely painful. People are ostracized. They're, you know, they're completely alienated. And as Rahab said, you know, a really sad case that even her family would alienate her in her own home, and then put into special schools. You know, and some which are the saddest cases were hidden from society because people thought it was witchcraft. They thought there was a bad omen, you know, and they didn't want to be associated with that. Parents were.
So is that mentality still there today, Rahab? In your work, do you find that there's people today who believe that?
There are several out there who are hiding their children. They are not able to bring them out because of the discrimination and also those misconceptions that this is a case of being bewitched. And also people have not really accepted that you are a normal child like any other child. When you are born like this, they don't accept that you are a normal child. So it is still there, but we are doing a lot of awareness. Yeah, a lot of awareness.
Yeah.
It is.
I want to understand last year when there was the, you know, sort of resurgence and I think there were vaccinations going around and there, you know, people going door to door trying to offer vaccinations to children. There was a lot of concern about should you just give your child another vaccination even if they've got it? Do you say no? How do you even remember, did they get the vaccination? So how should parents go about that if they're unclear as to how many times their child can get the vaccination?
Well, yes, generally the vaccinations should really be happening in the health clinics and in the hospitals. And but because not all the mothers are going to the health clinics and the hospitals for their vaccination, it has become necessary to do these immunization days and to go out door to door and do the immunization. So generally, I think we're looking at about 3 doses for a child from the time that they're born until the time that they are 5 years old. And when the child is born in a health clinic, one of the vaccinations they'll be given immediately will be the polio vaccination. And as they keep coming back for their vaccinations, they'll get those polio vaccinations as well. But now it's necessary, and it's become necessary to go out there. And it's so important, because if we do it and we have that universal coverage, we will then be able to get rid of polio completely and get off the threat that we don't need to have children getting this debilitating disease or even dying from this disease.
So is there any wait time between the vaccinations? Because I feel like I do remember having people knock on the gate. I think I remember that.
Okay.
I don't know if it's earlier this year or last year.
Yes.
But so is there a time that you should wait before you then offer the vaccination or you have your child take a second dose?
Generally, it's between 1 and 5 years. You need to do the three doses,
Okay.
and to be completely safe from it.
Okay.
And so the UNICEF and WHO are providing the science behind it, and circulating the polio vaccines. And these polio vaccines have to be carried in a certain way, in a cooler box, to ensure that they can still be effective. And so they've built up a tremendous distribution system globally, so that this can continue to happen. And in 1979, the U.S. Was taken off the endemic list. They had seen they eradicated polio from the U.S. and continued to do that until you had parts of the Asia Pacific that were the disease was eradicated. And now the disease generally tends to remain more around Africa. And that's why we're still under threat in terms of, it's not been completely eradicated.
Right.
We're off the endemic list,
Yeah.
but it's not been eradicated
Completely,
yet.
yeah. But you're not clear, it's still not clear how soon you should wait. Is it best then in that case to sort of ask a medical practitioner, if you have access to one,
Yes.
or go back to your documents, I imagine, because, you do have a list of when each one was given.
Indeed. I mean, in most cases, that first dose is all that needed. But because you have the other cases, or you have possibility of other cases, then it's necessary to have the other doses as well.
Okay, got it.
But there is hope.
Yeah.
There is hope. And if in 1985, those 350,000 new cases of polio, and through the funding that's come through the Global PolioEradication Initiative and Rotary, we've been able to reduce the cases by 99.9%. That only in this year until to date, we've only had about 81 new cases of wild polio virus.
Right, in the world.
That's in Pakistan and Afghanistan.
Yeah. Rehab, I want to talk a little bit more about how this has affected you. Not physically, though. I want to understand how it sort of changed your life and how you were able to cope with it from an emotional and mental perspective, because it does carry with it a lot of shaming from community and for people who just don't understand. So my first question would be around your family, and if you were able to resolve, the distance between you and your father.
Well, I can say I was able to do that, but that was later when I did my O-levels. That is when we sat down and discussed the whole issue, and he became apologetic. Yeah, and committed some money to clear my balance in school because I had not cleared my balance. So he committed some money, told me to tell my mother where to collect the money because they never used to talk because of me. So it was not good.
So how did you deal with that? The knowledge of even that, or over and above what's happening to you physically?
It was not easy. It really affected even my education. You can imagine going back to school, you have nothing, no shopping, no school fees. My mother has to struggle. I had siblings. We were 7, so I had others in school. So my mother had to struggle to meet the needs of us all, yeah. And what she was earning was so meager, so she could not meet all our needs. So I used to use my wisdom, all my knowledge, to acquire what I didn't have. So I could teach some mathematics to the students who had come from well-up families, yeah, and they could support me with soap and other things. So you can imagine I was so demotivated because I don't have the basics, yeah, to even take me through. And but I had to push through. I just had to push through. So my dad, when we sat down with him after I had completed my form, he saw me at home. So he asked me, "What are you doing at home?" He didn't know I've gone through school, I've finished. Wow. So I told him, "Nilimaliza shule, now I'm at home and I'm waiting for whatever will come out." So he told me, "And why are you at home? Where are your papers?" I told him I don't have any papers because I had a balance in school and my mother was not able to raise the money. So he told me where to get the money, to tell my mother where to get the money. It was by then 7,000 shillings. The 7,000 and take to school for my papers to come so that he can assist me in getting myself at least a college. Yeah. But unfortunately he died before he was killed. Oh. Yeah, he was murdered. Yeah, so he was not able to fulfill his dreams. Yeah.
But were you able to sit down and have a conversation?
We did.
And were you from that moment able to forgive him?
I was. In fact, I had forgiven him. I loved my dad. I loved him deep within my heart. I knew what he was doing was not right, but I loved him. So I had forgiven him even earlier, but he was not close to me. He kept his distance. So that day he was able to invite me to sit with him. We had lunch together. So we talked.
Great.
Yeah, we talked, yeah.
And what gave you that grace? What provided you with that grace and wisdom?
I can't tell, but I loved my dad. I loved him, yeah.
What would you say to someone who's currently going through maybe that kind of ostracizing, or has it, whether it's from polio or from another disability? What would you share with them that would make them feel, that kind of grace and spirit that you so
I would tell them first, you just have to accept that this is something you cannot change, so you have to live with it. Yeah, so disability is not something you can change, so you just have to accept that you have to live with it for the rest of your life. Then you have to love yourself first. When you love yourself, you're able to give the same to others. So I just had to love myself first. And I could tell myself every morning that I'm fearfully and wonderfully made. I could smile, throughout the day. So I was able to impact the same, to the rest. So when they saw that I am happy, I'm contented, they also started being happy about me, and they started accepting me in their setups, So they could welcome me in their homes, we could go to church together, they could assist me where I'm not able to access. So that is how I developed that sense of feeling that I belong, and I knew that there is more to life than having a challenge. I used my challenge as my strength.
Yeah.
So I became strong.
And I feel that. I feel it radiating off even as you're speaking right now.
I was so disadvantaged. I was very vulnerable. There were so many opportunities that were supposed to be mine. I never got them because of the challenge. But I thank God because today I can stand and say that disability is not inability.
When did you make peace with your reality?
After
was there a moment?
After my O-levels. Though I was not able to go to graduate to a nice college. Okay, I had qualified, but there was no funding. There was no money. So I was forced to stay at home and wait for whatever comes. So that is how I found myself in this world of voluntary and community services, and doing short courses out there. But I was not ready to accept that I am a loser in life.
Far from it. From everything you've just described.
I was not able to accept that I'm a loser in life. So I had to fight with the little knowledge that I had, and to date I can say I'm proud of myself. Because my mother is staying comfortably. There was an interview that was conducted at my home the other day And they found my mother. She's happy. I've kept her well. With whatever I get, yeah, I'm able to give my mother the best life. So she's proud of me. Yeah, yeah.
Whoa. All right. So, Joe and Rehab, I guess, how can the community come together to fight this? How do we together help end, and eradicate polio altogether?
Well, Sharon, I think one of the things we've seen is that not everybody is as strong as Rahab. Rahab has gone through a really tough time, but she's been able to come out of it in a positive way. But then there's so many children at that time that just did not have that kind of support of of a mother who could just give up everything to just make sure that her children would survive and get through this, through being ostracized by the community and the family. And so within the polio fight, Rotary has committed to raising $50 million every year for the next 5 years. And to do so, this is towards the polio endgame strategy. And so a lot of this funding comes from the West and comes from Asia. But Africa is the one that's most under threat. So it's important for us to be able to show that we have a commitment for the children, for our children, to ensure that they don't have to go through this hardship, this debilitating disease, and perhaps death. So we've now launched a campaign within our district where we will raise $1 million to put towards this global polio eradication initiative. And this $1 million, if we raise $1 million, the Rotary Foundation will match that with another $1 million. And the Bill and Melinda Gates Foundation will come in with $4 million, which will mean for raising $1 million, we actually raise $6 million. And $6 million can immunize 18 million children. And I believe that if we do this in this year and continue to work on the funding goals next year, we will truly be able to eradicate polio. And the polio endgame strategy is between 2019 and 2023.
Wow. And what about you, Rehab? How do you think the community can show up for the children, whether it's to prevent or to support those who've been diagnosed with polio?
Okay, I can tell the community that now that there is a chance of giving the vaccine, there is immunization for this, the young ones. It is important that as parents, when you have the campaigns, they should bring out their children, because most of the work that we've been doing in the community as champions is to tell them that polio is real, polio is there, and it has no cure. So if you are not able to protect it before it infects your child, you have to suffer the consequences throughout your life. So I can tell the parents that there is a chance by immunizing your children. Let them get the vaccine as early as we are told, and as early as it is accessible. And I also want to say a big up to the Rotary Club. They've really done it for us. I can say since I was a child, I was so excited. When I heard the name of Rotary, I knew that goodies are coming, So they've been very supportive, and I would wish to tell the community out there, everybody out there, to support the initiative. Because it will really help to end this menace of polio.
And maybe to say a little bit more about this initiative, $1 million, raising $1 million is not going to be easy. But what we wanted to do was to allow the public to participate in this initiative. And in the countries that make up this district, Kenya, Ethiopia, South Sudan, and Eritrea, the total population is 172 million people. And all we want is for 1 million people to give $1 each. Or should I say 1 million people to give 100 shillings each. And we will have raised $1 million, which will be equated to $6 million. And then we'll be able to immunize at least 18 million children.
That's a lot.
Below the age of 5.
Wow. All right. Thank you. Thank you both for sharing your story, Rehab, and for being such a fighter. My goodness. And for you to have had that kind of wisdom and grace at, how old was that? 19 when you finished high school?
17.
17?
Yes. Absolutely.
That's like, look at you. You are truly a champion. So thank you, and thank you too as well. What the work that you're doing is obviously quite very impactful, and the fight is one that we should all join in. It's not up to Rahab and not just up to Joe. It really is our problem and our fight. So thank you for bringing that to our attention today.
Well, thank you, Sharon. Thank you for bringing us on this show. And I think it's such an important thing that, and we are making history. To be able to eradicate the second disease in human history.
Oh yeah, oh yeah. All right. Well, ladies and gentlemen, thank you for watching. We'll be back tomorrow at 8 a.m. Thank you to Parkin by Radisson, and I hope you have yourself a great rest of the day. I'll see you tomorrow. Bye, everybody.